Welcome back to the CritMedic podcast, and this week we're going to talk about phrases that really make you rage and just really make you pull your hair out when you hear people say them. So stay tuned, we've got an interesting show for you. So what are some phrases that really drive paramedics nuts and other professional providers nuts when they hear paramedics and other EMS personnel utter them? Well, there's a couple that really come to mind that I really want to share with you and go over. So without further ado, I bring to you phrases that make good medics rage. So the phrases that come to mind specifically are ones like BLS before ALS. And on its surface, it sounds like good advice. You generally want to do less invasive things when possible before going into more invasive options. But saying BLS before ALS has two major problems with it. One of those problems is the division between basic life support and advanced life support are really artificial and non-distinct. Before recently, epinephrine IM was considered an advanced skill. They started rolling out EpiPens to providers, I think, several decades ago, and just recently, check and inject became popular even at the BLS level. So the lines between basic and what's advanced are really starting to blur. Really, the general distinction in medicine is medicine works and medicine that doesn't work. We know epinephrine works, we know Narcan works. We know lots of medications that are efficacious are being pushed down to the basic provider. Does that make them a basic medication? I don't know. Do you think a doctor says, hey, let's start off with CNA before we go to RN and then RN before we go to MD? That's not really how medicine works. But unfortunately, it seems to be a prevalent mindset that's present in EMS, BLS before ALS. Let me give you two examples that come to mind. You have a patient who is presenting unwell, and in your presence, they arrest. The best option is to do an immediate electrical cardioversion, i.e. we defib them. And that's something that could be considered BLS, but if you're defibbing them manually, that's ALS. That's a really a weird distinction, and that's really not based on evidence-based medicine. The distinction between BLS and ALS is not a big deal. You want to go what medications and what treatments are best for your patient, regardless of whether it's considered basic or whether it's considered paramedic. Your unresponsive diabetics, BLS before ALS, well, there's not a lot that can be done from a BLS standpoint. I suppose there's rectal administration of glucose that might be an option in some circumstances, but generally speaking, if they're unresponsive, the option would be glucagon or dextrose, preferably 10% dextrose solution. So another phrase that really tends to grind my gears, and it does for some others, is EMTs save paramedics. And again, on its surface, this is an okay expression, but really it's not so much that EMTs save paramedics, it's partners save partners, whether it's another paramedic or whether it's an EMT basic or whether it's an advanced EMT in areas that have those. I'm sure that there's plenty of places where nurses help doctors and CNAs help RNs. So this dichotomy of lower level providers save higher level providers, it's not necessarily true. I understand what they're trying to say, that there is value to their input, and I'm not disagreeing with that. I just think that the phrase saving paramedics is not entirely accurate. And if a paramedic gets to the point where he's being regularly saved by an EMT, I'd really question as to how well they're doing as a provider if they regularly need this reassurance and this fallback, whether they can practice independently on their own successfully. So that's another phrase that I don't really think is accurate, and it tends to cause a little bit of irritation whenever I hear that. I respect my EMT partners, and I have some fantastic partners to boot. But I don't think anybody's saving anybody. I think we're both having a mutually beneficial partnership, and we're both providing assistance that's for the benefit of patient care. Another phrase that I really hate hearing is doing what doctors do, but at 80 miles per hour. Well, that's not entirely the case. Doctors would tend to rely a lot more on diagnostics, especially newer medical graduates tend to go with more diagnostic means, just because there's a greater emphasis on having verifiable, documentable means of verifying a diagnosis. So we don't have a lot of diagnostic measures available. Sure, we have 12 leads, and in some rare cases we have ultrasounds, but we don't have the same diagnostic means that we have that in the ER or that doctors have available to them. There's variations on this expression saying doing what ERs do, but at 80 miles per hour. Also, 80 miles per hour really depends on the road that you're traveling on. Surface streets, maybe not so much. Open interstates, maybe. But, I think it overemphasizes the point of driving fast, and that's not really what we want to emphasize as providers. We want to emphasize calm, competent care, and really from the grand scheme of things, we are kind of the low man on the totem pole when it comes to overall education. We could say doing what doctors do, but with 1/10 of the education behind it. Of course, that probably really doesn't sell t-shirts quite as well, but this happens to be the truth of the matter. The next one is they're too young to have a stroke, or they're too young to have a heart attack. And this is actually something that recently a friend of mine heard from a physician. So it's not just paramedics or EMTs that say, oh yeah, they're too young to have a heart attack. That can't be a STEMI. Well, actually, funny you should mention it, because there is actually a couple studies have been done on it, and there's actually a couple of pieces that have been published documenting case studies of heart attacks and strokes on very young individuals. So pediatric patients can have them. They're not too young to have a stroke or a heart attack. And even though a lot of times it's used for like 20-year-olds saying, oh, 20 years old, they're too young to have a heart attack. Well, that's not really accurate. Plenty of 20-year-olds can have heart attacks. Poor lifestyle choices, some congenital factors, Kawasaki's. There's lots of conditions that can cause a myocardial infarction, cocaine usage. So these people can have heart attacks, and people can have strokes. And saying, oh, these people are too young to have those conditions leads to an underdiagnosis of what is actually a pretty serious medical condition. So saying that, I think, does a disservice to patients, and it's not just a paramedic problem, it is also a physician problem. It's a problem across the board in medicine. And I think, hands down, the number one phrase that I hear that really grinds my gears, and some could say that it even triggers me, is this particular phrase over here. Treat the patient, not the monitor. I get what they're trying to say. The intent behind it is noble, and the intent is they want to emphasize that whatever you're looking at, despite that, there is a patient on the other end of that EKG. And if the EKG is looking abnormal, to double check and see if that has a clinical correlation with your patient's condition. I understand that's the intention, but too many times I see it used in online discussions and even interpersonal discussions where someone has absolutely no clue what the monitor is telling them. They say, oh, well, I'll just treat the patient, not the monitor. I mean, treat the patient, brah. And unfortunately, you kind of have to know what your equipment is trying to tell you. So this statement really kind of grinds my gears, so to speak, when I hear it uttered. And you also see on T-shirts, and the intent behind it is good, but it's a little bit of an oversimplification. I think the best expression would be something like, treat the patient in the clinical context of all available assessment and diagnostic means with full awareness of the limitations thereof. Unfortunately, that's not very catchy, and you'd have a hard time putting it onto a T-shirt. Actually, I stand corrected. I've seen some T-shirt word salads that you could probably really fit this on, and have some space to spare. So that's another phrase that really tends to cause a little bit of irritation for me. So, moving on, the next one that I think. Next category that I think would be useful is the honorable mentions. and these are your t-shirt designs. And we have some really cringe-worthy t-shirts in EMS. Like absolutely abhorrent. I just can't even begin to describe them. We have some nice t-shirts, but unfortunately I think the quiet, understated, professional t-shirts are far outnumbered by the t-shirts that are, well, let me show you. So there's this one. This is what I like to call EMT word salad. It's got a lot of words, random font changes, icons, pictures, and decoration that just really makes it gaudy and god-awful. I'm an EMT. I was born with my heart on my sleeve and a fire in my soul and a mouth I can't control. Thank you for your understanding. Well, I think the problem with this shirt is that it tends to overemphasize some aspects of EMS. The fact that we sometimes can't control our mouth is less to do necessarily with the profession and more to do with the individual provider. And I find it's really more creating excuses for just bad manners overall. And to some extent, a lack of professionalism. So I'd kind of be embarrassed to be seen in a t-shirt like this. Plus, my heart on my sleeve. There is a certain amount of provider resilience that's required in this field. And given that we have a problem currently with above average provider suicide rates, it really takes a little bit of provider resilience to prevent that sort of occurrence. So we want to make sure that we don't overemphasize the emotional aspect of it, that this is a difficult job, but we don't try to wear our heart on our sleeves. That's not something that we aim for. So the next t-shirt that I think is a little bit cringeworthy is this one over here. Again, same typical EMS word salad on a t-shirt here. Only an EMT can drug you, cut your clothes off, tie you down, inflict pain to arouse you, paddle you, and have you thank them later. What is that? This is just a t-shirt that emphasizes all the wrong things about EMS. This really emphasizes the negative aspects, the pain and the negative stimuli that people can encounter. And I think that might lead to more of an aversion to EMS than really a positive public perception. So this is the kind of shirt that I think we should try to avoid whenever possible. So the next shirt that comes to mind is this one over here. The man wearing this shirt is a EMT. Don't panic, keep cool, lie flat on your back, and do everything the nice EMT tells you to do. So if we're going to make shirts, I think one of the key takeaways is to at least make sure that we get the grammar right. I mean, AEMT, things like don't panic, keep cool, fine and dandy, chive on, etc. But at least put punctuation where it's supposed to go. There's a distinct lack of punctuations. I find your lack of punctuations disturbing. So the next one here is another one of these fine t-shirts. I save lives. I possess a skill set 98% of the population can't do. EMS, I'm the last of a dying breed of people who aren't afraid to get their hands dirty. Well, that's not entirely the case either. When we look at the very basics of the profession, entry level, at a minimum, I think the minimum is about 120 hours of what amounts to introductory first aid. And I'm pretty sure that more than 98% of the population can accomplish that. And the last of a dying breed of people who aren't afraid to get their hands dirty, given how many EMTs and paramedics look down on people who assist patients with the real dirty work of saying, well, they're butt wipers and things of that nature, I think we are afraid to get our hands dirty. So I definitely think this is a t-shirt that's sort of false advertising, I guess, if you will. So this is not a shirt that I would recommend to folks. And especially this shirt over here. EMT. My job is to save your ass, not kiss it. Well, I'm not sure I can fully describe just how I think that has a lack of professionalism just written all over it. In a way, actually, I kind of like this shirt because it really helps to distinguish, between providers. And all these shirts are fantastic for that purpose. It really lets you know the mindset of a provider. But the EMT, my job is to save your ass and not kiss it. There's an important aspect of customer service in EMS and patient care. To a certain extent, I don't want to say there's, necessarily an ass-kissing aspect to it, but there's just a compassion aspect. And this t-shirt really just oozes a lack of compassion and understanding. So those are some of the fine EMS shirts that we tend to find. Those are the honorable mentions. So we covered over a couple of the high points here of some of the shirts that I don't like, and some of the slogans in EMS that I don't like. Especially high among those slogans, I would say my number one is the treat your patient, not the monitor. Again, that's a real oversimplification. Especially when it's thrown out into a discussion about an EKG. Oh, what's this rhythm? I don't know, treat your patient, not the monitor. Thanks for your contribution to the discussion. That's just outstanding. So, that about covers it for this week. Hopefully you'll join us next week. I'll have a new topic brought up for everyone to enjoy. And until next time, I will catch you around. And as always, keep thinking differently.